So we're seeing increasing numbers of survivors, and it's partly because of the ageing population, but we're detecting more cases of cancer at an earlier stage, and we have better treatments. So that results in more people surviving. Follow-up care has traditionally been led by doctors and usually hospital-based. We know that there's a limited number of doctors, and also survivors don't always have all of their issues identified and addressed. And so we're really keen to explore new models of care. So I think that key skills of nurses are that they act as patient advocates, and they're also expert at assessing the issues and concerns that patients have, and they're really important parts of survivorship care as well. So nurses are very well placed to provide survivorship care, and most nurses would say that they feel that survivorship care is an important part of what they do. So certainly there's been a number of studies that have looked at nurse-led survivorship care, and that's compared nurse-led care with more traditional doctor-led care, and nurse-led care can be at least as effective. It has some advantages, and it's also perhaps more affordable and more scalable.
Nurse-led care. It's just with knowing that you have a issue that you don't know how to deal with it, and then coming in and having these nurses support you, talk to you, make you feel a human and not to worry.
We got funded from the Department of Health and Human Services to run a Gippsland Survivorship Clinic, and it became really quite successful. So luckily Latrobe Regional took it on as an official clinic. So when we see patients in the clinic and the nurse-led survivorship care in a holistic view, we approach the patient when they've finished their treatment, so they're referred into the clinic by a clinician. We approach them, we explain the clinic, so essentially it is only 2 appointments. We provide nursing care plans, so end of treatment care plans. We get all that information from their history, so we go through their diagnosis and their treatment in the first appointment, and that usually goes for about half an hour to an hour. And then the second appointment is usually about 4 weeks afterwards, and we go through their late side effects that could possibly happen from their treatment, whatever it may be, whether they just had radiotherapy or radiotherapy and surgery and chemotherapy. We go through their follow-up care, what surveillance they need, what surveillance follow-up they need, when to see the specialists. This is a really good resource for patients to take home with them. Their GP gets sent their care plan as well as the hospital. And we also provide the ACSC resources as well. So when a patient comes to you for support or comes to you with any sort of late side effects or any sort of lifestyle involvement, we're here to help them. So we can help direct them into the community, and we can relay that back to the medical oncologist as well, or the medical specialist. So the difference between a regional hospital and a metropolitan hospital would be that there's lots of resources in-house in a metro hospital, whereas in regional areas, it's quite sparse. We use a lot of community services as well. So, for example, like a lymphedema nurse is outsourced to the community health service. Psychosocial, we refer back to the GP, whereas Metro would be all sort of in-house. Yeah.
Nurse-led survivorship care is delivered as part of standard care at the Olivia Newton-John Centre at Austin Health. The nurse-led clinic runs in parallel and alongside standard medical follow-up for patients post-treatment for their haematological malignancy. The benefits for additional nursing care for patients post-treatment completion is that nurses have the overall understanding of the disease that the patient had and the treatment that the patient received. And they also have insight of what that journey looks like for that particular patient. We try to be proactive and preventative, so we see patients as early post-treatment as possible. The time frame is anything from about 4 months onwards post-treatment completion that they can be referred into the haematology nurse-led survivorship clinic. That referral can happen through my own clinical practice as a haematology nurse consultant or any clinician within the haematology service, or the patients or families can refer themselves. Before they come to the clinic, they're invited to complete a set of validated questionnaires which are posted to them prior to the clinic. And that addresses their level of emotional distress, their cancer survivorship unmet needs, and also the issues around returning to work. So when they attend the clinic, I feel informed where that particular patient is at that time. Then I can dedicate time to that individual, address their unmet needs and put the supports in place. Through the nurse-led consultation, which I usually dedicate about 45 minutes with that person, they receive their own tailor-made education package addressing their unmet needs with evidence-based material. And I can then develop and create a treatment summary and survivorship care plan, which is shared with the GP, and then put referrals in place for dedicated healthcare professionals to support those patients adequately. So then the patient feels confident that their GP is informed and able to support them post-treatment for cancer-related issues and also non-cancer-related issues. And that's what we try to do, is actually equip the patient to better self-manage their life post-treatment completion. That's through the clinic itself, but also referring to key healthcare professionals to better support the patients.